Are you getting all the important stuff your body needs to stay healthy? If you have a problem with your kidneys, there are things you need to know about vitamins and minerals. Vitamins and minerals are things your body needs to do important jobs. They help your body get energy from food, fix tissues, and stay alive. They're super important. But if your kidneys aren't working well, you might not be getting enough of them. Almost all vitamins and minerals come from the food you eat. Your body can't make them on its own. If your kidneys are healthy and you eat lots of different foods, you probably get enough. But if your kidneys are sick or you're on dialysis, you might not get everything you need from food. So you might need to take pills to get what you need. Your doctor and a special dietitian for kidney problems can help you figure out what you need by looking at your health history and blood tests. If your kidneys are sick, you might need more or less of some vitamins and minerals. Here's why. Waste builds up in your body when your kidneys aren't working right, and that can change how your body uses vitamins and minerals. Some medicines you take can change how your body uses certain vitamins and minerals. If you're on dialysis, you might lose some vitamins during treatment. The special diet you follow for kidney problems might mean you miss out on certain vitamins and minerals. Sometimes, when you're not feeling well, you might not eat enough food to get all the vitamins and minerals you need. Depending on your health, your doctor might suggest these supplements. B-complex are a bunch of vitamins that help with different things. Some help prevent anemia, which is when you don't have enough red blood cells. Red blood cells carry oxygen around your body. If you have anemia, you might need extra iron to help treat it. Vitamin C helps keep your tissues healthy and helps wounds heal faster. Vitamin D is important for your bones. You might need it if you're on dialysis. Calcium, along with vitamin D, helps keep your bones strong. So, which vitamins should you avoid? If you have kidney problems, you might need to avoid some vitamins because they can build up in your body and cause harm. These include vitamins A, E, and K. Taking too much of these can make you feel dizzy, nauseous, and can even be dangerous. You should only take these if your doctor says it's okay. There's also a concern about taking too much vitamin C, which could lead to problems if you have kidney disease. So, is it safe to use herbal remedies? If you have kidney problems or you're on dialysis, it's best to avoid herbal remedies and over-the-counter supplements. They might not mix well with your prescribed medicines or could have bad side effects. Always talk to your doctor or pharmacist before trying any herbal remedies or supplements. If you have a kidney transplant, make sure to check with your transplant doctor and kidney dietitian before taking any vitamins or herbal supplements to make sure they're safe for you. Thank you for watching. Don't forget to like, comment, and subscribe. Watch more videos by clicking on this video right over here.